Hey guys, how's it going? So today I just want to talk a little bit more about hypertension or high blood pressure and some therapeutic options in that regard. Hopefully in a future video I can talk about different causes of hypertension. But basically the majority of people out there have what is known as primary hypertension. Some people call it essential hypertension, for which we really don't know what's causing it. I mean, it could be a number of things like genetic factors, especially people have genetic factors that disposition that affect the renal tubules and the kidneys. Societal, we live in the West here. We eat a lot of salt. That can be another thing that leads to it. So let's get into how do we really treat high blood pressure. There are several different guidelines to follow. In general, we want if somebody's under the age of 60, we want their blood pressure to be less than 140/90, and if they are above 60, we generally aim for maybe less than 150/90. So there's four major classes of drugs for hypertension that are used commonly in first and second line therapies. If somebody's blood pressure is like say 20 points above goal, it's recommended to maybe start off using two drugs right away. And it's actually been shown that suggested that two drugs at moderate doses is better for the patient than one drug at a maximal dose, and that's because that way you can also cut down on the side effect profile of just the one drug because you're using such a high dose of it. So let's talk about the four classes of drugs that I want to talk about here today. Thiazide diuretics. These are basically diuretics that make you pee out a lot. They work really good. They work very well in African Americans, especially because African Americans are more sensitive to salt, and it helps you pee it out. They're good for heart failure patients, and they're also good for elderly patients who have a isolated systolic, which is the top number being high. Some potential side effects of this. The acronym that I used to use when I was studying for my USMLEs, especially step 1, was hypergluc, GLUC, elevated glucose, lipids, uric acid, which can lead to gout, and calcium. Let's see. Especially for hydrochlorothiazide. Not so much furosemide. Hydrochlorothiazide is the most commonly prescribed thiazide. However, it's funny because a lot of the studies were done on chlorothalidone, but I know when I was doing primary care, I used to prefer hydrochlorothiazide as my first option. Another class of drugs are the ACE inhibitors, angiotensin converting enzyme inhibitors, and their cousin drugs, the ARB inhibitors, and so these are great for patients in heart failure, post-MI, especially patients. You want to use these for patients that are diabetes because the renal protective advantage of these drugs. So anyone with proteinuria, diabetes, metabolic syndrome, and heart failure, obviously, and post-MI. Contraindications: can definitely not use these in pregnancies. These are teratogenic. Make sure the person is not at an age where they can become pregnant. They can also cause they're contraindicated in patients with bilateral renal stenosis, renal artery stenosis, and hyperkalemia. The next class of drugs is calcium channel blockers, such as Norvasc. Norvasc is what's the other name for it? Amlodipine. A lot of people like to use this as first line. I used to use this as first line a lot. And it's great for people with, it's great for African Americans, also great for elderly, again, who have isolated systolic, elevated systolic hypertension. One of the major side effects that you will see in it is patients get swelling and edema in their lower legs, so just look out for that. You do not use it in patients with heart failure. Beta blockers is the other class of drugs I just wanted to talk about briefly. We generally don't use these as first line for hypertension, but they are great in the setting of angina, heart failure, post MI, myocardial infarction, heart attack, and they are also great in pregnancy. We do not use them in patients with COPD or glucose intolerance. Also, patients with peripheral artery disease might not benefit from them as much, and that can be a contraindication. So that's basically my brief talk today. Thank you for listening. All right, bye.